We start your 5 o'clock news hour. Last week's debate on whether or not to ban abortions in the state has renewed efforts to make contraceptives easier for everybody to get to prevent unwanted pregnancies.
As News 19's Becky Buds reports, lawmakers are looking at the health insurance plan for public employees to do that.
For more than 500,000 South Carolinians who are employees in the public sector does not cover birth control for those employees' children.
A huge proportion of my patients are covered under that insurance, but they're not really covered, right? Because they can't access medication that I am prescribing for them that we feel is appropriate.
Dr. Crystal Tomlin, an OBGYN who specializes in adolescent gynecology, comes across what she calls an unnecessary barrier every day.
Here's a family who was making mature and responsible decisions in conjunction with their mature and responsible adolescent, and they ended up having to pay over $1,000 out of pocket.
But that could soon change. Debate on whether to further restrict abortion in the state has started bipartisan discussion about requiring the state health plan to cover contraceptives for all dependents.
One way to get less abortions is to have less pregnancies, and planned pregnancies are obviously the best form of pregnancies. So I don't see a problem with it. Of course, if we're going to restrict abortion further, then these issues become more prominent. And this is just one of them, but one of those issues is expanding our insurance coverage.
According to the Public Employee Benefit Authority, which oversees the insurance plan, there are more than 26,000 female covered dependents ages 15 to 25. According to PEBA, more than 9,000 of those have their contraceptives partially covered for reasons other than birth control, like ovarian cysts, endometriosis, and bleeding disorders. PEBA says fully covering the cost of contraceptives would cost about $3.2 million. That number includes coverage for the anticipated 6,000 dependents who PEBA believes would choose to be covered under the plan. Changing the health plan policy requires approval through the budget process. In Columbia, Becky Buds, News 19 WLTX.
In May, Governor McMaster signed a law allowing pharmacists to dispense birth control pills and other hormonal contraceptives without a prescription.